Can I just clarify, because I think the wrong impression was given about some of my suggestions. On the amount, my suggestion was that you could get 2 ounces at the site. You could have the rest delivered, so you could get your full 10 ounces. And I put in that if there would be an exception to the 2-ounce limitation, in other words, you could get your full 10 ounces there where home delivery posed a hardship to the patient. So in other words, if you lived in a veterans housing building or something like that, you'd be able to get your full amount at the dispensary. So I think that was not clear. Also, I want to say on the appointments, I left number to be determined on the appointments in a single hour. What they say they get at in Northampton, that might be 16 per hour. And I also left in a provision that they could have 1 additional emergency appointment. So if somebody was just coming from chemo or something and needed to stop in, they would have that opportunity. So I just want to clarify that.
That is proposing a model to which patients can pick up medication at a time when it's convenient for them, similar to a pharmacy. I also do not support imposing additional product purchase limits beyond the state imposed limit.
Regarding appointments, I feel there is no need for NETA to operate by appointment only. It is an imposition on the business without benefit to the town and, more importantly, an imposition on medical marijuana patients. My other concern is Brookline's proposal on the limit to the amount of marijuana that can be purchased per visit. The Department of Public Health allows purchase of 10 ounces every 60 days.
So just to talk about the restrictions a little bit, I'm going to be starting chemo in another week, and I want to visit NETA when I leave Dana-Farber, and I never know when I'm going to be leaving Dana-Farber because, you know, you can have an appointment at 10 and not get out till 6. And if I have to make an appointment for medical marijuana, it's really going to be upsetting. So the restrictions, I think, ridiculous for patients, very unhelpful for patients.
I think, just briefly on the conditions and the appointments, elderly, many of them are not driving anymore. They're using the ride, they're using the senior transport bus. You never know when you're going to arrive when you use those vehicles. It's great that it's available, but it is not if you're going to have to be at a certain time at an appointment, again, I think it's going to work against it. So
the limitations on required deliveries and amounts below the state limit have the potential to increase the burden for patients acquiring legal medical marijuana. In my opinion, this has the potential to at least drive patients to other communities, acquire through the underground market, or just suffer and not get treatment.
You know, I mean, like, there's all these restrictions. I mean, what does CVS do in Brookline? When I go to the dispensary, I need to get like 4 ounces because of the products that I make for myself. And I'm just asking that, to reconsider that. I mean, we want to make it easily accessible for sick people. And I think we deserve it.
And my concern is that by imposing further stipulations, we're really hampering access for patients who really need this material and who are in a position where further regulations and stipulations bar their access. To say that, oh yeah, the dispensary will just fit them in to some emergency slot is also unrealistic of the business model. Furthermore, the limitations on the amount that they can get preclude their getting what they need when they need. I don't think that these stipulations are necessary or beneficial to the community.
I've seen patients come to the dispensary, an appointment-only dispensary, and sometimes be turned away because they did not know that this facility was appointment-only. They've gone through the lengthy process of getting their card, and they finally come to the dispensary and sometimes can get turned away. The in-store purchase limit of 2 ounces I feel is also unacceptable. The Brookline Selectmen should not stand between the patients trying to procure their 60-day supply. I ask you all to please reconsider the purchase limits and appointment-only visits. Thank you.
I'm here to represent those who've died waiting for our representatives to take real action to help the LGBT community. Medical marijuana can equal lives for some people with AIDS. How many coffins need to be buried before the people take action? AIDS patients dying on their deathbeds do not deserve to wait for their medicine, depending on appointments and availability and access.
I speak to many patients, and they do have a lot of other things going on in their lives, and picking up their medicine could only take 5 to 10 minutes. So the purchase limits, as we've heard, people have many different applications of cannabis. Someone can easily go over the 2-ounce limit that you're imposing. If they want to come and purchase over 2 ounces, they should be able to do that.
I am particularly concerned about the condition proposed that would require me to make an appointment to visit the planned dispensary, instead of creating regulations for a problem that may not exist. I would encourage you to show this organization some respect and let them propose solutions to real problems that come up, instead of tying their hands behind their backs with a bunch of regulations for problems that may never arise. Please grant this facility a license to open as soon as possible.
I am opposed to the asking for appointments because it is difficult to get somewhere at a particular time. It's inconvenient. There will be a limit on the number of appointments, and that will mean people will have to wait days, maybe weeks, to get their medicine. I don't think that's appropriate for a type of medicine for patients. I'm also concerned about the quantity limit. I don't really understand the point of it. I don't know what we're worried about.
I'm really proud of Brookline. Even proud of Nancy for coming up with these ideas that I think are fakakta ideas, but I think they need to be looked at. I really am, Nancy. I don't agree with you, but I'm extremely proud. I just don't see hampering people that are ill helps anybody. It doesn't help the town. It doesn't help the people. The 2-ounce limit. People use marijuana in a number of different ways. We don't know what their needs are. The state has determined a level that they think is considerate of those people's needs, and I think we should live with the state's limits. Let's hold those things back. Let's hold, Nancy, your ideas back. They're good ideas. Let's just not implement them when they're not necessary. Let's implement them as they're needed.
I am opposed to restrictions on limiting the amounts of marijuana, medical marijuana dispensed that is less than what the state mandates. Also, the restriction of appointment only, I think, is unreasonable.
But I want to say that I oppose those 2 proposed license conditions, the 2-ounce limit and the appointment only. I think we've heard in a very moving way tonight how they actually create real burdens that we may not understand. And to say I have to have a specific time appointment to pick up my medicine is crazy and unnecessary and doesn't really serve any real public interest.
But all these issues that Nancy raised, those 3 issues particularly that she had trouble with, were vetted. Also, do you worry about people not wanting to make appointments in the morning, not wanting to make appointments between 4:30 and 6:30? Are you crowding them into, certain hours that might not work for them? So let's support them, and I hope you, I really appreciate your time here tonight, and I hope you don't impose those conditions. Thank you.
I would like to think about is, instead of the language that Nancy proposed, take the language in the application that I had read earlier, which has, during this opening period, a careful analysis of how the traffic would work, and then notice to the town that they're going to transition to the quote normal model. So that's one thought.
And one of the things that I want to think about over the next week or so is about whether that 2-ounce limit is the right amount, if we should entertain a proposal or an idea to increase it to 4 ounces, 5 ounces, 6 ounces, or that idea is just a non-starter in general. So just a message to my colleagues here, that something that's on my mind. and something I'm going to be thinking about.